The following is a paid program. Advice and opinions expressed during the program are solely that of Marshfield Medical Center, not WBEV 95X or Good Karma Brands. Now, your host for this hour is Rick Armon.
Well, thank you very much, Thomas, and we say good morning to everybody. We are down in the video pit today because this program is not only on our station, AM station, WBEV, but also on Daily Dodge TV, and we are excited to have some real good folks here to talk about a lot of exciting things, some things that are very important to talk about, and some other things that are super important to get out there. So, first of all, I want to introduce Angelia Foster from Marshfield Medical Center. It is great. You and I have spent a lot of time together the last 2 years, haven't we?
We have, yes.
Yeah, so let's get that microphone a little bit closer here. So we also have Dr. Jimmy Deering, who's joining us as well. Howdy.
Howdy. Good morning. Thank you for having me.
And Dr. Seth Baruden, who's adjusting his microphone right now as we speak. How are you, sir?
I'm doing well, thank you.
It's good to have all of you here right off the bat. We're going to talk about a lot of exciting things that are going on. We had a chance to sit down last week at the hospital and talk directly about all the big happenings in the orthopedic department, which is really exciting news. A lot of exciting things coming up, but we've got to also get down to the stuff that is the brass tacks, the really important things that is concerning people in this community. And obviously that involves what's going on right now with COVID-19. Angelia, when you and I first started talking in April or May.
You gotta turn those on.
Oh, I thought you guys had done that already.
No, same matter.
Yeah.
Do we have to turn them on?
No, you don't have to turn yours on.
Just
There we go. All right, sorry about that. We might have to adjust the microphones a little bit so we bring that down. Anyways, we welcome everybody on in. We do have the microphones now fully working. And I'm Rick Armon, along with Angelia Foster from Marshfield Medical Center, Dr. Deering, and also Dr. Seth Baruden. We're glad to have you here with us. As mentioned, we're going to be talking about the great things that are taking place at the hospital. Very exciting times. At the same time, some stuff that's not exciting, but stuff that we have to talk about. When you and I first started talking, Angelia, I want to say it was April of last year, 2020. And we started talking about what was going on at the hospital and how, beds were filling up and everybody at the hospital was getting so tired because they were working such long hours and long days and not seeing their family. We thought when we heard that vaccines were coming out that a lot of this stuff would be in our rearview mirror, and that just hasn't happened yet.
So a year ago tomorrow, we gave our first vaccine. And I remember last Christmas Eve thinking what a gift that was to the community to have a solution to this COVID situation. And to be where we are now, where we're double our average daily census, we have up to 6 people boarding in our ER. And what that means is there's not a bed upstairs for them, and there's nowhere else in the region for them to go. And so if you're having symptoms of a heart attack, or you break your leg, or you have, something that happens, you cut your hand cooking, you're coming into the ER, we're slammed with COVID patients, and you may not get as quick a care as we would like, or be able to get to the level of care that we would like. When 6 people have to sit in an ER overnight to receive their care, that's not ideal. And so I really want the community to hear us this time. Please accept the gift of the vaccine. I know it's not something we like to have lots of conversations about. I know there are lots of opinions, but it is your way to protect yourself and those that you love, and more importantly, to give us a little reprieve. I have nurses saying to me, I'm not sure I can do this anymore.
I have.
You all, we don't need that in our community. We have been able to be a stellar facility to this community for almost 100 years. I don't want to lose my nurses because they're tired, because their friends, their family, their neighbors are not taking this as seriously as they need to. So I need their help.
Right, and I know that from my own personal, I have a best friend that I've had since high school, and their daughter is an infectious disease nurse at a major Milwaukee hospital. And to hear the stories of every night that her getting home and taking off her clothes in the garage so that she can go in and shower before she can even touch her kids. And this has been going on now for 2 years. And that's the kind of stuff that's heartbreaking. And to hear stories from somebody like that talking about toe tagging patients on a daily basis, it's like, I don't understand. I don't understand when there is something that's crazy, something that's available right now that can pretty much guarantee that that's not going to be you.
Correct. So we know that vaccines help to reduce your risk of hospitalization and death, right? We've had 250 people die in Dodge County. That should be enough. We really need to think about what we're doing here. And being the 10th, I looked it up, we're the 10th lowest vaccinated county in the state. That's why we're seeing some of the things that we're seeing with us being at maximum capacity, people boarding in the ER, and really sick folks not getting exactly what they need in the moment that they need it isn't a good place, especially when there's a solution we can manage to. And
We
so
need
I'll
to- right.
turn it to these two experts.
Exactly. That's why I wanted to bring in people obviously directly tied into something crazy that has been a lifesaver for a lot of years. It's called science. Dr. Deering, Dr. Bruden. First of all, I don't want to get into the whole apparently political end of things of where we've gone with this. I want to talk just from a science standpoint, from a standpoint of how fast they were able to develop this vaccine. And tell me if I'm wrong. I've been telling people this whole time, I said, to me it's a miracle because when you get everybody in this world, the biggest brains in this world, all working on the same problem at the same time with the same energy, this is the kind of results you're going to get. Is that accurate?
A miracle.
Right.
I mean, a straight miracle. Oh, I'm not close
Yeah,
enough.
there you go.
So I would agree in that year ago when we were able to get liquid gold is how it felt. This little vial of liquid gold that was going to start saving lives and get us back to normal lives. So that was a joyous, absolutely wonderful day, and extremely grateful for the work that went into the vaccine. It went through all of the normal processes a vaccine would for approval, just without the risk of the funding stake. They were able to shorten those timelines. So it went through the regular committees, went through all the regular process. And now we've seen it used exponentially because there has been a great majority of people that have embraced the vaccine. And we know that it's safe and we know that it's effective.
Right. Dr. Bruden, what about the one group that is still left out there? If you want to turn your microphone down towards you a little bit, and hopefully it'll stay. The one group that is still left that has not been able to have a vaccine is those real young kids. It sounds like there was a little bit of a setback in that. Where are we right now?
So I think they're back to looking at what amount of vaccine is going to be effective in getting their little immune systems to respond in a favorable way. So I think it was not felt to necessarily be unsafe. It just wasn't effective at the dose that they were using. So they're just going to have to do trials and make sure it's safe at a slightly higher dose to really basically kick their immune systems into a response that shows that it's working.
So because we have such a panel of experts here, the booster shot. We've been telling people to get the booster shot. I got mine as soon as I could. What exactly does the booster do for somebody that's already had 2 vaccinations?
So the booster is basically a reminder or a kind of basically sending a response to your body. So it gives you a new amount of material that your body then recognizes, but is at low levels of immunity from its prior vaccination. So when you get a vaccine, you develop immune responses. Those immune responses are little tiny compounds in your body that go around, float around, and they're there when you get invaded with an actual virus. So they can respond quickly and prevent it from getting into your cells and creating a systemic infection. What happens after 6 months, after they did the studies, and we've had the vaccine long enough to now realize that after 6 months, those little tiny compounds, those little tiny materials in your body that are naturally developed from the vaccine initially, they start to break down. They become much smaller in concentration, and they're much less effective at mounting a robust immune response when you get infected. So they realize that after about 6 months, we need to reboost the system. And we don't know how long this reboost will last. And my statement to patients often is it may need to be done on a regular basis, but that is potentially what we'll see, or we may see that after that 3rd or 4th boost, the body just says, okay, I'll remember this now, and these will be in my system at a high level for a longer period of time. We just don't know. What we do know is that it's significantly safer. In fact, it's safe, and it's way better than getting infected.
Right. I think that's the one thing that people don't understand. And Dr. Deering, the one thing that I've heard from people is, well, I got COVID last year. I came through it okay, so I got those antibodies in me, so I really don't need to have anything else added to that. That's just not the case. That's absolutely not accurate.
It's not accurate. The same way we don't know how long the natural immune response lasts is what needs to be followed with the immunization. And so it's like, well, if you have one way of fighting something, would you like that, or would you rather take something that is 100 different ways of fighting it? And so I can certainly appreciate why people feel like, hey, I had this, wasn't too bad, I'm good now. But frankly, they're just leaving the other 99 things on the table and not taking advantage of it. We don't know how long natural immunity protects people. We don't know, but we do know that the immunization works. It reduces your risk of death and hospitalization, and we're probably going to say that a few more times because that's, folks, where we're at.
Right.
I mean, it's reduced your risk of hospitalization and death, period. And so the booster, and this is, we make up a lot of fancy terms in medicine, right?
Right.
I mean, we like our terms. But booster, what a great word, right? It boosts your immune system. So folks, get out there, get that booster on top, because it's just going to give you, maybe then you get up to 1,000 different ways of fighting this infection off. It just is, it makes good sense.
We keep on learning new things, Dr. Bruden. One of the things that we found out is that there are these different compounds, these different medicines that can help people once they get COVID. Different companies, Eli Lilly and Regeneron and all this type of things. But the one thing that has come out lately now is that a couple of those are no longer effective against Omicron. So this virus that we think doesn't have a mind of its own does have a mind of its own.
Yeah, so the current treatments, I think we're starting to see what's actually effective and what's not. We do know, as far as Omicron goes, that it potentially takes more infections to create the same amount of number of hospitalizations and really sick people. So it's less virulent. We kind of, that's a fancy term.
Right.
We love our
Yeah, you guys
We love
love
our
your terms.
So it's going to make the average person less sick, but it's going to infect a lot more people. So it's just, this all comes down to math. If you get a whole bunch of people infected, even though a less percentage of those people may get sick, there's still the sheer volume of people may need significant care, and that's what overwhelms the system. As far as treatments for those folks, I think the current antibodies are really aimed at the kind of the Delta and the initial strain.
Right.
And so they're not matching up as well with Omicron. I think those can be quickly, based on the same science that developed the mRNA process, they can be synthesized quickly to match Omicron. But whether or not we'll need that versus just kind of continuing our testing and hopefully kind of mitigating the amount of spread that we're seeing in communities, and then hopefully vaccinating folks, because that still is very effective at preventing hospitalizations and deaths. And I think, people still hear about breakthrough cases. They still get worked up about, man, I've gotten the vaccines. People are still getting sick, and, why should I even get it? And when we really look at this statistically, it reduces significantly your chance of not just getting sick, but having really bad complications. So back to the, if you get sick and you need a treatment, there are still potentially treatment options. But really the best way for us to combat this is to hopefully prevent it.
There was an old car commercial that I remember growing up, and it was the mechanic standing there wiping his hands off. He goes, well, folks, you can pay me now or you can pay me later. Basically, what he was saying was that, okay, it's going to cost $100 right now to do all these things in your car, but if you don't do this, a year from now, it's going to cost you $2,000. And that's kind of the same way with your body. You get yourself a vaccination, which last time I checked, I don't know if there's a charge for a vaccination.
It's not.
Right? So I don't have to pay for this vaccination, and then I don't have to pay the thousands, the tens of thousands of dollars, or my insurance company doesn't have to pay it because I was in the hospital because I didn't get it.
Correct.
I mean, right? And now we've also heard about Pfizer coming out with a new pill that is supposed to be another one of these things that you could put in your war chest to help us in the fight against something that's a very deadly virus. You guys got to be excited about all these new things that come out, but at the end of the day, the one thing that we know works is vaccinations.
By far be my preference and what I would speak to for people, because the other ones are a bit like a Band-Aid. And you're talking to primary care doctors. And
Right.
so, it is our passion and bread and butter that we want to prevent illness. We want people to be healthy. And based on the evidence and what we have, the vaccine is the way to go. And some of it is also resource and allocation. As Angelia was talking about, our team is tired and they are stretched. And there was a great movement away from healthcare after the first surge.
Right.
We haven't recovered yet.
Correct.
We haven't recovered from that, and now we're moving into what this is. And it's been a few months of this already, at least since August. Our
Yes.
team has been tapped here in this town. And it doesn't feel like there's an end in sight. And so when we talk about getting the vaccine, we mean it. Because when it comes to those other therapies, we scramble to try and figure out how to get that done to meet the community need, because that is our mission. But it's been a long, long haul.
Can I just speak to that? So, we talk a lot about the science and kind of the reasons for this, but I think ultimately, I had an opportunity to help in the hospital recently, and I think what people need to understand, hopefully, is that as much as this is a service-dependent industry, we have machines and beds and all these things. It really comes down to the people doing what they can to take care of patients. And I saw people working to the absolute maximum of their physical ability, and there still was more work to be done. There's still more patients that needed care. And I don't know that people truly understand that if they get sick or something occurs in their household or with a loved one, there may not be a person or a machine that's going to be able to take care of them. And I don't say that lightly.
Correct.
But that is not just unique to Dodge County. Dodge County is seeing it in an immense way, but everywhere is seeing it. And from my position in primary care, we're being asked to not send people to the emergency room for things that we can hopefully manage as effectively as possible, taking significant risk in the outpatient setting because they don't have capacity. So this isn't just about, doing what you can to help the tired healthcare system. It's really about doing what you can so that you can get care if you need it.
Right. I mean, we're coming into a time of the year where typically when we start getting a lot of snow and we get cold, all of a sudden we have people slipping on ice. We have people all of a sudden feeling a tingling sensation up their arm as they're shoveling snow. And I'll tell you what, if it's my grandma, if it's my grandpa, I want them, or my mom, I want them to be able to find a place that they can go to get that care. And this is not, as you mentioned, this isn't just Beaver Dam. This is across the country.
Yes.
I mean, you look at statistics right now for ICU beds across this country. It's scary. And if people aren't getting that, I don't know what else to do. It's kind of like you're beating your head against the wall. It's a very, very frustrating thing. Something I always think about when I think about something like getting a vaccine, I always think about getting on an airplane, and that flight attendant says, okay, folks, now, if the masks drop down, before you worry about everybody else, put it on yourself so then you can take care of them. You get that vaccine, you can still take care of people. You can still take care of the people that you love that might have something else going on in their life. At the end of the day, that's what we're all about, right?
Exactly. And I would just say to the community, I think about when COVID really started, I was new here, right? And one of the things I was most impressed with was folks saying to us, can we bring meals to the hospital? Can we make masks and drop them off? Can we stand outside and bang pots and pans so that those heroes know that we appreciate them? What you can do to help those healthcare heroes is get vaccinated. That's what they need you to do. They need you to get the shot so that you can protect yourself. You can protect those who can't protect themselves. In our health system, we've heard of really young ones passing from COVID.
Yeah.
I think, was the child 8 days old? Is that what we heard?
Oh, no.
I don't want that for any of us. And so if you really want to help your healthcare heroes, get the vaccine. And I can tell you how you can do it. We've got clinics. We'll get you in. So please call our vaccine hotline at 1-855-908-5029. We'll get you an appointment. We'll get you a walk-in, whatever you need. Please go into the holiday season thinking about how you can give back to others. This is a way.
Yeah.
Well, And within 1 week of getting your first dose of the vaccine, it's already 80% effective, is what we've seen. So it's not too late for seeing family members yet this week, next week, if we're happy to change some minds.
I know Dr. Bruin's got to leave here pretty quick, but I just want to ask a quick question, and that is this. There's 3 different main vaccines. You know, everybody's going to have an opinion about those. From a medical standpoint, are you just get one of them?
Yeah, I mean, if people are like wide open and they want to know, I typically refer them to the Pfizer or the Moderna, the 2-shot series. I think the Johnson & Johnson unfortunately got some bad stuff happen in the very beginning. It had 9 people died from weird blood clot disorder. So, but if people have had the Johnson & Johnson, they tolerated it, they should get their second one as a booster. But if they're not wanting to do that, they can get any one of them as a mix and match type of process. But typically, if people are asking, I'll say to get the 2-shot series with either the Pfizer or the Moderna.
Okay, excellent. Before we move on to other things, is there anything else COVID related that we want to try to get out? I mean, Dr. Bruden?
Just that I was going to get my 18-year-old daughter her booster shot today, so I appreciate the plug for the number, because I absolutely will use that because she's home on break and hoping to go back to college, but it looks like they may be going virtual because of the cases nationally. So obviously this isn't going anywhere, but I really appreciate the opportunity and the advocacy that our hospital here is really working on helping our community. So thank you.
And that's what it's all about. Well, thank you very much. All right, we're going to take a quick break, and then we'll be right back with more of our special program with Marshfield Medical Clinic coming up.
From the Metalcraft Studios, you're listening to AM
34. The following is a paid program. Advice and opinions expressed during the program are solely that of Marshfield Medical Center, Beaver Dam, not WBEV 95X or Good Karma Brands. Here's our host, Rick Armon.
All right, before we move on, we just wanted to kind of wrap up our conversation. Dr. Bruden, you had a couple things or something that you wanted to mention.
Yeah, I was just, we were just talking during the break about kind of some of the scariness of what's happening kind of in the hospital setting. And I think I was able to kind of witness an example of what we're experiencing on a regular basis, which is really the inability to move people to care facilities where they can actually get the care that they need. And examples of that is multiple, whether it's somebody that's got long-term need of a ventilator, or someone that has a very specific type of surgery that they need for life-threatening reasons, and they just don't have the capacity elsewhere. And so we're seeing people that need extensive specialty, high acuity care that we are not able to move out of our hospital, and are being kind of forced, for lack of a better term, to manage those folks as best we can, which is not the ideal way to manage these folks. And I've seen people slowly but surely get worse because they are not able to get to the facilities that they need because of the overwhelmed healthcare state. And so, without trying to give too many details, it was just devastating for the healthcare team to watch this situation, and for this family to have to see that. But there was no availability. There was no way to move this patient. And so I just think that is just an example of something that can happen to any one of us, where we need care and we can't go and get care at the right place because they're too full. Yeah. And I don't know that people understand that, and sometimes we take it for granted that that's always going to be available.
And if I can chime in on that, 'cause I think devastating is the right word. And I need to thank Dr. Bruden, and there's 3 other community doctors who are normally outpatient doctors in our town that have stepped up to help our hospitalist team on their own goodwill when we are in a pinch. And so, Dr. Bruden and the others have really been a great example of teams pitching in to help each other and help the patients. So thank you for that. So during his weekend, while he was able to see that example, it's not uncommon now. So it's not just one family, it's happening over and over. We know there's facilities that are basing their priority list on transport as far as what's the likelihood we can help this person and not likely. We have our own team that we've put together when we need to decide how to utilize what we call scarce resources, be it vents, be it beds, be it personnel. We're doing the best we can. But this inability to transfer is something I never thought I would see in Beaver Dam. I've been here a long time. Seth's been here Dr. Bruden's been here a long time. And what we do in Beaver Dam, we do it well, and we know what our limits are and when things should go to those bigger places like Madison, Milwaukee, Marshfield, Maine. That's where they get those subspecialists and that real expert care that we don't have here, being a rural regional hospital. And to have to keep those patients and look at the families and tell them we're doing our best, and our staff making hundreds of phone calls trying to find a place without success day after day. It is devastating. I think that's the best word I can describe it. And so that just was the additional thing to add on to this is we are making our plea for vaccination, and it's with good reason.
Right. I mean, it's like trying to put out a forest fire with a spray bottle.
Yeah.
I mean, that's where we're at right now, and that's why we keep on asking people to ignore the things that you're reading or your friends are talking about. You're getting, I hate to use the phrase, you're getting fake news. You're not getting the truth. And the truth is, the medical field has been able to save so many lives over my lifetime, my 60 years on this planet, and a lot of years before that, because of science and because of things that just plain and simple work.
Yeah.
And we need to give everybody a break. We need to get back to normal again.
Yes.
And last week when I had a chance to be at the hospital, which felt great, by the way, it felt great to be out again. I had a chance to meet your entire orthopedic team, right?
Yes,
I mean,
yes.
we're talking the surgeons,
Yes.
the chiropractor, the physical therapist. You
We
guys
have
are building
massage.
something there, aren't
We
you?
are, yes, yes. It's our desire that no one has to travel outside of the region to receive specialty care that makes sense for us, right? And we have great partnerships in the region. We work with UW quite a bit. Marshfield Clinics bring lots of specialists into town. But before we close out on COVID, Rick, I just really want to say one of the things that's been most impressive to me of our medical staff is these are brilliant human beings. And they have loved you through the best and the worst times when you've gotten sick, or your mom and dad have been sick, or your children have been sick. And so as the administrator, to watch them and listen to them and see the hurt that they have, and to see the frustration of, I don't know what else to do for this person.
Right.
Think about when they've taken care of you when it was the little things. They're begging you when it's the big things. Please get vaccinated so we don't lose this talent.
Right.
Because many healthcare providers right now are really thinking about, is this what I want for the rest of my life? We can do something about that as a community. We're not selfish. Let's not behave in ways that show that we're selfish. Let's help these brilliant minds who have committed their entire career to our community. Show them that you care about them. Get the vaccine, please.
Yeah, and let's build that medical.
That's
Let's
right.
build those medical positions back up to where
That's
they were,
right.
because at some point, every single person listening and watching to this is going to need one of
Absolutely.
them, whatever
Yes.
it might be.
Yes.
You know, and that's why, you know, it was such a joy last week to talk to
Yes.
the doctors
Yes.
about orthopedics, because, you know, being a person that works with physical fitness when I'm not doing my radio stuff, I know how important it is for those people when they need to have a hip replaced.
Mm-hmm. Yes.
I've talked to people that have had hip replacements and knee replacements.
Yes.
And they said, why didn't I do this sooner?
Yes.
That's the first
Yes.
thing that they say, because
Yes.
they lived with this pain all this time.
Yeah.
It's got to feel great to have the power of Marshfield Medical
Yes.
behind us here in Beaver Dam.
It's pretty phenomenal. And I'll let Jamie speak to a little bit more of it because she's been here her entire career. But I'm really impressed with the level of specialization we're allowed to and able to bring to Beaver Dam and to the region. We want to be a regional destination for healthcare. And for those regular things like a hip replacement, or we're going to have a full-time cardiologist come January. These are things that we need in our community so that we all are on the road to wellness. And Jamie, you want to talk a little bit
And
about
I
that?
wanted to say
Yeah.
that just because we live in a smaller town doesn't mean we have to be a smaller town.
Correct.
I also, before lived here, guess where I lived? Marshfield.
Excellent.
Guess what I was used to up in Marshfield?
Exceptional
Unbelievable, exceptional medical care.
Yes.
And that's what we got in that small town. Well, it's a little bit bigger than Beaver Dam, but a small town anyways. A lot of cool specialties coming in. We found out about a spine specialist that's coming in.
Right, and for those that don't know me, I grew up in Randolph, so this is local. This is my home. This truly is where my family is. And I spent, I knew as a second year medical student I was coming back to Beaver Dam to practice, and I've been here 20 years now in the town with medical care, and I never imagined that we would be doing spine surgery in Beaver Dam.
Right.
So while I spoke before about not having all specialists, we don't, like cardiothoracic surgeon's a good example, but spine surgery is something that we can do safely when you have a good qualified person to do that, and we do now. Dr. Fairchild is an experienced, and he's a wonderful spine surgeon. And he wanted to he wanted to work for Marshfield, and he wanted to be in Beaver Dam. Well,
Hello.
right.
Come on
I mean, it's
down.
like,
That's right.
Come on down.
Really? You're getting this message. It's like, wow. Like, so I get really excited because I didn't think that would be something that would be part of my career.
Yeah.
And so the reason that I joined Marshfield is because of its reputation. And because it's physician run, the physicians and providers, they want to work for Marshfield. And our location makes Beaver Dam very attractive.
Mm-hmm.
That's how we got our dermatologist, who is fantastic. That's how we're getting full-time cardiology. And this will be the first time we've had a cardiologist who's going to be dedicated to Beaver Dam, not coming and going a few times a week, not taking cases back and forth to bigger towns outside of here, but really be able to take care of our patients. Because guess what? We have a lot of heart disease in Beaver Dam, right, in Dodge County.
Yes.
Now we're going to have a cardiologist who's going to be able to take care of the patients here. His name is Dr. Gill. You'll be able to meet him too at some point.
Yes.
But he was one of my mentors in residency. So one more full circle experience for me. That's
So
just
it's kind of
delightful.
cool because, I think anytime anybody lives in a small town that has a hospital, you're thankful that you've got it, right?
Absolutely.
But you also get used to saying, well, we're going to send you to Milwaukee. We're going to send you to Madison. We're going to send you, that's the way it is, right?
For the complex.
Right.
Yeah.
But now we're starting to get in a situation where you guys are starting to actually have these specialties in-house, which not only is really cool for you, I mean, there's, let's be honest, there's some prestige with that, right?
Yeah.
But what's really cool is for patients.
Yes.
Oh, absolutely.
Right?
And can I add in is that they're not necessarily waiting a few months for appointments?
Right.
Yes.
Yeah.
Days and weeks.
So we're talking about good quality and access without driving. It sounds like a slam dunk.
Yes, for sure.
So for you coming into the situation, I mean, you came in at a horrible time. It's like, I can just imagine like, oh, hey, I'm moving to Beaver Dam. Oh, by the way, we've got a pandemic.
Yes,
Real fun, right?
Yeah,
Yeah, just a
yeah.
blast. But to see now all of a sudden that you're able to start adding these different features to your clinic is exciting.
It is. It is. And what I'll say, right, the pandemic wasn't an ideal time to start, but it has shown me exactly who this team is. And they do incredible work every single day. And so they also, here locally, make it so easy. While we're a close drive to Madison and Milwaukee, which makes providers want to live in Beaver Dam, which is the reason lots of people live in Beaver Dam, the really cool part is the team makes it seamless for those new providers. Our staff welcome them. Every doctor that comes to visit us goes, there's something special about this hospital. I just feel differently here. That's how we want it to be. We don't just want it for the providers, we also want it for our patients. When you come to us, you're full of anxiety and stress, right? Nobody comes because it's a good time. But what we want you to feel is that we're doing everything we can to make you feel like the most important person we've taken care of, because that's how we feel about you. And so to have these level of providers willing to come into our community and provide these services, it's a real win for our community.
Can we talk about some of the other things that are happening?
Yeah.
I just heard a big announcement on the air the other day that
Yes,
my doctors,
yes.
some of my favorite people in the state of Wisconsin, Vita Park Eye Associates,
Right.
are part of your
That's
team.
right, yes.
How did that all come about?
Well, first, I just want to thank Dr. Castillo and Dr. Wilkins and the others who came before, because they've had like a 75-year history in our community. Is
Right.
that right?
Yes.
And so thank you for taking care of our community. But the cool part is, like Jamie talked about, they're choosing to work with Marshfield. They could have worked with any
Right.
of the competitors in town, and they're choosing Marshfield because it's physician-led, right? And they want to be part of an organization that aligns with their values. And I got to tell you, they're both rock stars. We had the chance to meet with their team this week. We spent a couple of hours talking with their staff. Good, solid, kind people providing exceptional care. We want that as part of our medical program. And it's another service that we didn't have at the hospital. They've been working with us, but they weren't part of our permanent family. Now they're part in May, they'll be part of our permanent family, and we're so excited to have them as part of the team.
You said physician-led. Dr. Jamie, what exactly does that mean, that term? I keep on hearing you guys throw out the term physician-led.
Yeah, thanks for the opportunity. So our CEO is a physician, Dr. Susan Turney.
Oh.
So the head person of the entire organization is physician and has been and will be board directed. And so from there, leadership goes in a cascade where there's an administrative arm and a physician counterpart, which is why you see us, we are the leadership for the Beaver Dam region. And that's the model. But when it ultimately comes down, push to shove, it's a physician making those end calls, not an administrator. And I am an administrator now,
Right.
right? I mean,
Yes.
but that's where the physician-led comes from, and it permeates the whole organization.
Yeah, because I just thought you guys were like a team for the Amazing Race. I thought that you were just
Well,
joined
we
at the
could
hip.
be.
Might be
We
good
could
at
be.
that.
Right.
Yeah.
I mean, that's kind of what I thought was going on here. That to me makes a big difference because of the fact the people on the front line, the people that have the science behind them and everything like that, have those little shiny things that are on the wall.
That's right.
Those are the people that I kind of really want to be making my decisions
That's
when it comes to my
exactly
health care.
And truthfully, it's what makes my job so much easier, right? Jamie is my perfect partner. She has the clinical experience. I don't.
Right.
And quite frankly, you don't want me making clinical decisions because I don't know, right? I dry heave when my kids vomit. Like, I'm not the person. And so to have us work in partnership, to be able to make really big decisions on behalf of our region together, and what services do we bring to town? What things make sense for Beaver Dam? To have her as my partner has been a blessing. And so I tell her about every day, this is the best working relationship I've ever had, and I trust her immensely. And we make some pretty important special decisions for Dodge County that I wouldn't want to make on my own. I only want to make them if I have a physician partner with me.
So there's got to be some other stuff that you can, and I'm not going to ask you to let the cat out of the bag on stuff that is still being negotiated. I would do that actually, but I'm not going to do that right here. But are there other things that you can tell us that are kind of in the works?
How about our new psychiatry program?
Okay, that's something that's brand new.
Yes.
That is brand new, and has been a much needed service. Talk about
yeah.
more fallout from pandemic, right?
Right.
And behavioral health was sorely in need even before the pandemic, but even more. I mean, we really have seen a lot of people struggling. So very pleased to announce starting in January that Dr. Scott Borkenhagen will be joining our team as a full-time psychiatrist. He is interested in board certified for child psychiatry, but we'll be doing some adult as well. But the hospital has been a long time without psychiatry services, and so we are really looking to expand that program. We're interviewing for a nurse practitioner as well as several counselors, and so we'll have a program there to really help our patients in the community, and this is just a really big win for us. So
Well, I was going to say, because, we're talking about the pandemic. I mean, I myself feel like physically, I've done great through the pandemic, right? Because I've socially distanced. I haven't gone into big crowds. I wore my mask. I got my vaccination. I got my booster. I've done everything I was
you're
supposed
a poster
to.
child.
Yes.
Right.
Right,
I've done. I
poster.
think I've done
That's
everything
right.
that I should to keep myself
Safe.
healthy, right? Physically healthy.
Yeah.
But I'll tell you what, that mental health
Yep.
is as or more important
Yeah.
than the physical health. And it's okay to say you need help.
Yeah.
My generation, man, they weren't really that great at that. They were not great at saying, I might be struggling a little bit here. But now you have the opportunity to do it right here.
Yeah.
Yes, no, it's a huge win for us, and again was relative to a physician who wanted to work for Marshfield and really
Yes.
loved our team, and so
Yes.
we're very grateful for that.
This time has gone really by fast.
Yeah.
We only have about 3 minutes to
Okay.
kind of wrap things up. What else did you guys want to get in before we have to wrap up?
I think for me, I just want the community to hear, a couple of years ago, this affiliation with Marshfield happened. And there were some pretty big promises made, right? And I know that there are lots who are watching and waiting to see. I think having a full-time cardiologist, a full-time pulmonologist, a full-time urologist, a full-time dermatologist, a full-time psychiatrist. These are incredible services that in the midst of the most unprecedented pandemic, we've been able to bring to this community. I'm just really proud to be part of a team that understands that even in the midst of this really crazy time, we've got to continue to bring the services that people are going to need, not just now, but for the long haul.
Right, and hopefully that's going to be a situation where, in a very short amount of time,
Yes.
we're going to be able to kind of go, really go all in on this and make it so it's really easy for everybody. Dr.
Yeah.
Deering?
I think the one thing we didn't talk about coming yet in March is Dr. Singh for our pain specialist.
Oh, sure.
And so we've had a gap there for a while for pain, and we know that this is another big community need. So very excited. Dr. Singh will be relocating from Minocqua, a Marshfield physician, and be doing full-time practice here in Beaver Dam.
Well, all I can say is we really enjoyed sitting down with you guys.
Yes.
I appreciate just the brutal transparency and honesty that we started off this program with, because this has been the feeling that I have had, and so many other people are feeling the same thing. We all want the same thing, right?
We do.
We all want to get back to normal. Everybody,
yes.
But we have to do something before, get vaccinated.
Absolutely. Please get vaccinated and get your boosters as well.
Right, take care of business. Merry Christmas, happy holidays to both of you.
Same to you.
Merry
Thank you so
Christmas.
much. And Thank you to the community for all your support.
Thanks to Ninja and Thomas and John for running our broadcast, and everybody have a fantastic holiday season.
The proceeding was a paid program. Advice and opinions expressed during the program are solely that of Marshfield Medical Center, Beaver Dam, not WBEV 95X or Good Karma Brands.